Hi, my name is Dr. Meghann Hennelly, and today I'm going to be talking about anxiety disorders in children and adolescents during the COVID-19 pandemic. Illinois DocAssist presenters have no relevant financial relationships with commercial interests related to this presentation. We will start with a brief review of anxiety disorders and then discuss the potential effects of COVID-19 on symptoms of anxiety. We will also be sharing tips for helping families, and we will finish by providing resources that may be helpful for families and for primary care providers who work with them. Anxiety disorders are the most common mental health problems that occur during childhood and adolescence. About 13% of kids ages 9 to 17 experience some kind of anxiety disorder. Girls are affected more often than boys. Comorbidity is the rule rather than the exception when it comes to anxiety disorders in kids. About half of children and adolescents with anxiety disorders will have a second anxiety disorder or other mental health issues such as depression. I would now like to review some common types of anxiety disorders. Generalized anxiety disorder is characterized by extreme, unrealistic worry about everyday activities. Kids may worry about academic performance, relationships with peers, sporting activities, or even just about being on time. Typically, these young people are very self-conscious, tend to be hard on themselves, and strive for perfection. They may have a strong need for reassurance and frequently seek approval from others. They often feel tense and may complain of stomach aches or other somatic discomforts that do not appear to have any physical cause. Children with separation anxiety disorder often have difficulty leaving their parents to attend school or camp, to stay at a friend's or relative's house, or even to be alone in the same house as their parents. They may have trouble falling asleep without a parent with them in the room. Separation anxiety disorder may be accompanied by depression, sadness, withdrawal, or fear that a family member may die. Social anxiety disorder is characterized by a persistent fear of social situations. Children have a fear of scrutiny by others, embarrassment, or teasing. This may even lead to panic attacks in social settings and avoidance of such settings, which can interfere with normal activities and with normal social development. Phobias. So just like adults with phobias, children and adolescents with phobias have an unrealistic and excessive fear about certain situations or objects. Many phobias have specific names, and the disorder usually centers on animals, storms, water, heights, or situations such as being in an enclosed space. Young people with phobias will try to avoid the objects and the situations they fear, so the disorder can greatly restrict activities in their life. In panic disorder, there are repeated panic attacks without an apparent cause. Panic attacks are periods of intense fear accompanied by unpleasant sensations such as pounding heartbeat, sweating, dizziness, nausea, or a feeling of imminent death. Children and adolescents with this disorder may go to great lengths to avoid situations that could bring on a panic attack. Children and adolescents with selective mutism demonstrate a consistent failure to speak in specific social situations in which there is an expectation for speaking, such as at school. This happens even though they may speak in other situations, such as at home with their family, where they feel more comfortable. Obsessive compulsive disorder is the presence of obsessions, compulsions, or both. Obsessions are recurrent, intrusive, unpleasant thoughts, urges, or images, often recognized as irrational, intrusive, and unwanted. In kids, obsessions may not be recognized as irrational, especially in younger kids. Compulsions are repetitive behaviors that the patient feels compelled to perform to prevent anxiety and distress, often the distress associated with obsessions. Children and adolescents can develop post-traumatic stress disorder after they experience a very stressful event, Such events may include experiencing physical or sexual abuse, being a victim or witnessing violence, or living through a disaster, such as a bombing or hurricane. Young people with post-traumatic stress disorder experience the event over and over again through strong memories, flashbacks, or other kinds of troublesome thoughts. As a result, they may try to avoid anything associated with the trauma. Hyperarousal is also part of the diagnostic criteria for post-traumatic stress disorder. For all of these conditions, symptoms of anxiety must cause significant interference in functioning or cause marked distress for the child. And as mentioned before, comorbidity between diagnoses is very common.
Screening should be done routinely in the primary care setting and should come from multiple informants, meaning at least the child and the parent, and if possible, other adults, as anxiety may present differently in different settings. For symptoms that are mainly exhibited outside the home, such as selective mutism, getting information from a child's teacher, coach, camp counselor, etc., is very important. Screening should be able to give you some idea of the severity of anxiety symptoms and also the degree of functional impairment. The psychiatric assessment should include differential diagnosis of other physical conditions that may mimic anxiety symptoms, such as hyperthyroidism, as well as the evaluation of comorbid psychiatric conditions, such as depression. Also, consideration should be given to the role that anxiety may be playing in other psychiatric symptoms. For example, a child may present with oppositional behavior, but the oppositional behavior is driven by anxiety. Anxious kids who are being told to do something that scares them can be some of the most oppositional kids you'll see, but they often will not say or even be aware that they are anxious.
Moving on to treatment. Both therapy and medication are used to treat anxiety. Cognitive behavioral therapy, or CBT, is the most evidence-based psychotherapy for anxiety disorders. CBT explores the relationship among a person's thoughts, feelings, and behavior. It allows patients to identify negative thoughts and false beliefs, and then teaches them to test or restructure these negative cognitions. Most primary care doctors will say that there is no way to do CBT in a short office visit. However, psychoeducation about anxiety disorders, as well as instruction in basic relaxation techniques, are part of CBT. Parent-child interventions may be helpful along with CBT. Anxious kids tend to have anxious parents, and well-meaning responses to a child's anxiety can often make things worse, for example, by facilitating avoidance. For patients with moderate to severe anxiety, combined treatment with therapy and an SSRI is most effective. So when is medication treatment appropriate in a child with an anxiety disorder? Sometimes kids have anxiety so severe that they cannot even participate in CBT. In that case, we need to use a medication to bring that anxiety down a little bit so that they can participate in the behavioral treatment. If there's a severe degree of impairment or distress, and of course, if there's comorbid depression or suicidal thoughts, we want to address that with medication. Medication is not used for simple phobia unless the phobia is comorbid with another anxiety disorder that's appropriate to treat with medication. How to choose a medication? SSRIs, fluoxetine and sertraline, have been the most studied in children. They both come in a liquid form, which is very handy when you're dealing with kids who may not be able to swallow a pill. Fluoxetine, generally, we start at 5 milligrams, and the maximum daily dose is 60 milligrams. Sertraline, we usually start at 12.5 milligrams, and the maximum daily dose is 200 milligrams. I've had kids, actually I have a kid right now who's on a dose of 6 milligrams of sertraline. So having a liquid form, it can be really helpful to start low and go slow, and some very young kids only need a very small amount. No hard and fast rules, unfortunately. So these are some general guidelines. What we find in general is that primary care doctors tend to prescribe doses that are too low, and so definitely do not be afraid to push the dose up. And if you ever have any questions about if a dose is too high, or if a medication needs to be switched to something else, or if there are side effects, feel free to give us a call. That is what we're here for, and we're happy to help with any of that. Moving on to the effects of COVID-19 on anxiety. So COVID-19 can cause anxiety in kids for many reasons. For one thing, almost all of us are anxious about this, so to some degree. So there are a lot of messages of anxiety from the media as well as from adults in a child's life. Watching the news can definitely cause a fear of serious illness and death in the child themselves or their parents, especially for very young kids who have a limited ability to understand the true risks of a situation. Routines are disruptive, and that in itself can be very anxiety-provoking to many kids. And also, social contacts have been disrupted. There's been a lack of support from teachers and peers, and also it can be very anxiety-provoking when a child is told that it's not safe to see grandparents or other family members. However, some kids may actually feel less anxious, and I've definitely seen this in some of my patients. Being at home has allowed for the avoidance of anxiety triggers, whether school or peer-related. Most kids are getting more sleep, usually able to sleep later when they're doing schoolwork from home. And there is more quality time with family, which has been a silver lining for a lot of people in this pandemic. Some advice for parents. So parents want to be able to start and restart the conversation about COVID-19. Kids need ongoing and repeated opportunities to check their knowledge about the pandemic and also express their feelings. Parents want to assess physical complaints for underlying anxiety. Headache, stomach ache, shortness of breath, etc. can all be symptoms of anxiety. And somatic symptoms may be especially common when kids are exposed every day to so much information about illness. Parents want to monitor and limit media exposure. Kids are much less able to understand the risks of disease, which can result in feelings of anxiety and panic. Families really want to try to maintain a routine as much as possible. Lack of routine increases anxiety in all kids. Bedtime and wake-up time, school time for schoolwork, and meal time should be kept consistent. This doesn't mean that these schedules have to be the same as during the school year, because for pretty much everybody it's shifted, which is fine, but we just want to make sure that it's the same every day, whatever bedtime is. If bedtime is now 10 o'clock, tomorrow and the next day it should be 10 o'clock as well. Parents can limit excessive reassurance, so we want to make sure kids have the opportunity to ask questions and express their feelings, but excessive reassurance can also increase anxiety in kids in the long term. Primary care doctors can help parents to model calmness. They want to ask parents about their own level of anxiety and promote self-care, and also do some education regarding the parental transfer of anxiety to children. Some consideration for the treatment of anxiety in children and adolescents during COVID-19. It may not seem necessary to provide treatment for new or worsened anxiety that seems situational and or temporary. However, early intervention for all anxiety symptoms is likely to prevent problems down the road. Definitely consider starting medication and or therapy for patients who are presenting with significant anxiety during this time. For patients who are already in treatment, the frequency of therapy and or the dose of medication may need to be increased. These can always be tapered down when life gets back to normal. Also, for those children with anxiety who show improvement during COVID-19, it is important to maintain existing treatment. Finally, I want to talk about preparing for back-to-school anxiety. As mentioned, many kids have an improvement in symptoms while doing schoolwork from home, spending time with family, and avoiding peer interactions or stressful school situations. Going back to school will in most cases mean getting up earlier, more time away from parents, and adjusting to a faster pace. Gradual exposure to public places such as school and daycare settings, and also introducing time away from parents may make the adjustment easier. Also, as much as possible, maintaining positive changes in family life that have been brought on by COVID-19. Please visit our DocAssist website special COVID-19 page for resources and tips in talking to children about COVID-19, applications to support relaxation, managing home learning, screening tools for anxiety, and support for providers. Also see the American Academy of Child and Adolescent Psychiatry practice parameters for the assessment and treatment of children and adolescents with anxiety disorders. That can be found on the website of the American Academy of Child and Adolescent Psychiatry. Thank you for your time. Here is the contact information for Illinois DocAssist. Please give us a call. We're happy to do a consult with you anytime.